Hello, guys. So the NBA's Philadelphia 76ers All-Star center Joel Embiid, who's a Cameroonian international, has been diagnosed with Bell's palsy. So we're going to use this as a teaching opportunity to understand what Bell's palsy is, what causes it, its symptoms, and also how it possibly can be treated as well. So let's dig in. Bell's palsy. Bell's palsy is a neurological condition that can happen, especially in the face, which results in the limitation of facial expressions and muscle weakness. So, what causes Bell's palsy? Bell's palsy is actually related to anything that causes injury or paralysis of the seventh cranial nerve, which is called the facial nerve. Now, the facial nerve is a nerve that is responsible for most of the functions in the face. Now, the facial nerve exits the skull through a little space here and enters into the face underneath a mass of soft, let's call it matter, called the parotid gland. If you touch your ear here, you will feel some kind of softness. That soft thing you see that's under your skin is called the parotid gland. The facial nerve goes right under the parotid gland. So anything that causes any injury or affectation of the facial nerve as it runs through can cause Bell's palsy. So what is here talking about the causes of Bell's palsy? Bell's palsy has it's really relatively unknown, but it's always been associated with, for instance, if you have any irritation or swelling in this parotid area, definitely if here is swollen, it will cause a compression of the nerve, the facial nerve, and that will lead to the weakness of the muscle on the side of the face where the nerve is impacted. You've seen people oftentimes that have stroke, they can also have facial nerve paralysis. You see that there's a slight dragging of the face to the stronger side, because what happens is if your right side is weak and the left side is stronger, the stronger one pulls the face towards itself. And so the place where you have the drooping is usually the weaker side, and the stronger side just says, give me the face, and it pulls the face to this side. Another thing that also causes it, before we talk about what you see, another thing that causes it also is if you have a major tooth infection, especially in the molar and premolar dental area, that causes excessive swelling and also affects the parotid gland, you could have Bell's palsy. If you have anything that affects the TMJ, this is the joint just here. If you touch your ear as you open your mouth, you see that there's a part of the ear, the bone here, that opens and moves when you open and close your mouth. If there is a dislocation of the TMJ, which happens sometimes you find people yawn like, I'm like, oh. But if there's a forceful dislocation of the TMJ joint here, you could have facial nerve palsy. If you're traveling in a car and you let the window down to such an extent, and the wind is blowing very strongly against your ear and hitting this part of your face, you also could develop facial nerve palsy. So anything that affects the facial nerve where it exits the skull into the face could result in facial nerve paralysis, aka Bell's palsy. Okay, what are the signs and symptoms? I've already told you that one of the things that you find is drooping of the eyes and drooping of the mouth. All right. So because the stronger side, yeah, tends to pull on the weaker side, and so this part goes up and this part drops down. So often there's a problem with biting, even closing the lips properly. You find out that there's a little space, and you go, there's just this space that is still strong. This part is a problem. There's drooping of saliva, inability to hold saliva in and to swallow properly, because the muscles, you need your buccal muscles to participate in swallowing, to swallow properly. And so there's drooping of saliva. And then also you have, because when you there's some fluid in the eyes. Every time you blink, the eye, it helps to lubricate the lenses of the eyes, the cornea of the eyes, and so it doesn't feel dry. But because of that palsy, and because there's inability of the eye, the lid, to close properly and distribute that fluid appropriately, what happens is there's extensive eye dryness, and you find that the person, it seems to be crying all the time because they are losing the fluid that should have been just circulated around the eye and kept the eyes moist. Okay, so there's inability to shut the eye. If you ask the person, close your eyes really tight, this one is closed, this one is blinking, you can't, there's difficulty in closing. Chewing also becomes a problem because you need your buccal muscles to chew. So there's a problem with chewing, there's a problem with closing the mouth properly or drinking water, there's a problem with even eating, and there's also a problem with the eyelids drooping. Okay, so how can you treat facial palsy? Is to reverse the paralysis, to reverse the weakness. And so you need to start working on, that's why you need your physical therapist and the doctor as well. If it's a viral infection, yeah, I forgot to mention also in the courses that viral infections can also be attributed to Bell's palsy. And also, apart from viral infections, you also have things like diabetes, any systemic issues, blood sugar control, and all of that could also result in Bell's palsy. So if you see a doctor, then they can find out what exactly might be related to it and they start the treatment. It could help also relieve. But part of that treatment is also have your exercises. Okay, you need to have exercises that will strengthen your buccal muscles, maybe electrical stimulation. We have something called electrical nerve stimulation machines that you can put like little electrodes. I've done this several times with patients that's presented with facial nerve palsy. Stimulations, some tap, 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 elevation of the face, massaging the face, and making sure the muscles remember. No, 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 no. You got to pull up, you got to pull up, you got to pull up. And then you teach the person how to drink again to engage the buccal muscles. Maybe they can't use a cup to drink water. So what do? You have to teach them how to use things like a straw. They can suck on the straw. As they do that, you see that? Mine is strong. That's why you can see that deep. A visual nerve is a struggle. But as they keep doing that, they'll gradually see an improvement. Balloons, for instance, putting the balloon in the mouth and trying to blow on the balloon. They'll lose air on this side, but you need to start engaging that muscle all over again. And then another thing that you can do is sometimes we do strapping. Okay, we can use some very nice plasters, diagonal plasters here and here, and also pull it up here, and then we would keep that there for a couple of hours a day, teach the patient how to do that so that the muscles know that they got to go up, they got to pull the eyes in that direction. So I hope it's been helpful. I just thought it would be very good because my background is physical therapy, to use his condition as a learning point to teach us how we can manage Bell's palsy. But see your doctor and see a physical therapist or physiotherapist, whatever you call them in part of the world, and it hopefully will get better. I wish Joel the best, and I'll see you in another video. Cheers.